Welcome to the CanaCard Patient Management System. End-to-end technology solutions providing safe access to medicinal marijuana treatment in Canada.
The Holy Grail is to link patient hyper-personalization with clinical trials, with genomic data, with history of present illness, with signs and symptoms. All of that linked together, that's the vision, that's possible. That's where we want to be. A company called Xanadu, if you guys know Star Trek and the tricorder, the medical tricorder of Star Trek? This is the vision of this company, is to build a device, list in the bottom right, bottom left here, that you hold it on your forehead basically, and what it does is measures your vital signs in 5 seconds. So you can measure all of your vital signs almost instantaneously just with touch. It also can measure an EKG, so a heart tracing as well. So this is a fabulous device. It's in production. It's going to be released pretty soon. So I was part of the team that developed that. This is a fascinating advance in medical science here. Another one called a LiveCore is a device that's able to get an actual EKG on your smartphone, on your iPhone. So you put a sensor on your heart, and through your iPhone you can get really an EKG tracing. Fascinating. So as we all love our animals, right? The first application that was tried was dogs and cats. And so you get EKGs on your household pet. It's kind of a funny thing that's around. There's another. This is a fascinating company that really uses the combination of smartphone technology and social media. So this company and others like it. There's 4 or 5 others, but they go through your social media data. It's a little scary, but it's interesting. Okay, and they say, okay, well normally Bobby tweets 100 times a day. Okay, but now he's only tweeting 10 times today. And so he normally changes his Facebook status 3 or 4 times a day, but now he hasn't changed it yet. So it sort of goes through the algorithms and predicts that Bobby's probably not feeling well today. So someone's going to give him a call and ask him how he's doing because his social media patterns have changed. So these are looking at social cues, really getting hyper-personal, and linking that to healthcare data. So that's also kind of this part of this end holy grail, is to understand how the links of social media, healthcare data, sensors, and big data come together. Okay, so that's something that's we're learning more about this. Another company that we're part of is Transfuse Solutions. What we look at is blood management. Now in Canada, you guys are really good at blood management compared to the rest of the world, and certainly compared to the United States. This is a graph that's kind of interesting. So if you go in hospitals in the United States, if you go in for a heart bypass, a CABG, coronary artery bypass surgery, if you go to hospital A, you have a 5% chance of getting a blood transfusion. That's pretty good. But if you go to hospital Z, you have a 90% chance of getting a transfusion for the same procedure, for the same comorbidities subtracted out. It's called clinical variation. So that's something that we need to reduce.
Or stupidity.
Right. Yeah. So it's the clinical variation is huge. So we need to really use evidence. And so this is a company that we look to use evidence and data to really help affect clinical change and help patient outcomes. So there's an opportunity here with the CanaCard platform to gather all that data and use it to affect solid clinical change. Apps can be a big part, mobile apps can be a big part of the decision process for understanding how to treat patients. Telemedicine, the remote delivery of healthcare. So this was from 1920 or so. So there's a radio doctor, right? So the idea of having a doctor in your home was proposed in the 20s, so 100 years ago, and it still is just now taking off. Ontario Telemedicine Network is probably the world's leading network for telemedicine. There's some in the States as well that are decent. The technology looks like a robot. So this robot can be remotely controlled from a third-party computer. The doctor can drive it around the hospital. It's pretty cool. This is basically a suitcase that can go in an EMT in an ambulance, take care of patients remotely, and then we have iPads now. There's peripherals. You can get weights, blood pressure. You can use that Xanadu device to get vital signs. So this is something that I wanted to show, the ability to link up telemedicine with the CanaCard. And so this is the Google Glass. So this is a live, active telemedicine platform. So we're doing this right now in strokes. So we have ER providers wearing the Google Glass and neurologists on the other end who are basically seeing the patient live with audio, with video, with vital signs and all the data being transmitted through Glass and allowing for live streaming telemedicine. So we think there's a really big opportunity to combine the standard of care with medical cannabis using telemedicine. And Google Glass is probably a reasonable way to do this using the system.
Contact CanaCard for more information or for a live demonstration of the CanaCard Patient Management System.